The contract we've recently amended with Pfizer allows for them they engage to deliver up to 249,000 doses to Canada before the end of December. In terms of distribution, next week's distribution will happen through 14 different sites that have been identified across the country, one in each province and 2 in our 4 largest provinces. This is to be able to initially get doses out to the most vulnerable people, but also to demonstrate and to operationalize what is going to be an incredibly complex mobilization of vaccines across the country. It is a gradual process that is going to begin this coming week, next week. But let us remember, at the beginning, there will be smaller amounts of vaccines because we are both standing up our delivery mechanisms, but also because manufacturers are limited in what they are able to produce for this vaccine. The large mass manufacturings will be happening into 2021. But with these 249,000 doses coming in December, we will be able to begin on the most vulnerable populations and make sure that we have the logistical grounding and foundation in place to be able to deliver right across the country over the first months of 2021.
Prime Minister, a few weeks ago, you came out and said that Canadians are going to have to be prepared to watch citizens in other countries get the vaccine first. Then, I think it was last week, you said it didn't matter when we get to the start line, what matters when we get to the finish line. Now, today, you're kind of pulling a rabbit out of the hat and saying, hey, we're going to have vaccines in December. Did you instruct Minister Anand to go out and negotiate this deal to get a comparatively small number of vaccine doses because you were concerned about the political optics of seeing other countries getting vaccinated first?
We've been working on signing contracts that are flexible enough to get us the earliest possible doses of vaccines since this past summer. This was always an intention that we had to try and get vaccines to Canadians as quickly as possible, along with our imperative of securing the largest number of doses for Canadians possible from the largest range of potential vaccine producers. When we made a commitment to Canadians that we were going to do everything we could to give them the support and the path through this, we were serious about that. We know that there is a tremendous amount of uncertainty in terms of which vaccines were going to arrive first, which ones were going to be able to be manufactured quickly. These were always built into our process as possibilities. But until we were able to sit down here today and announce firm delivery pending the final approval by Health Canada, we wanted not to get people's hopes up because this is something that Canadians have been looking forward to for a long time, getting to these vaccines and getting beyond that. But I will say from a logistical and delivery standpoint, this is the largest mobilization of vaccines in Canada's history, and being able to start with a smaller number and rapidly scale up as the flow of vaccine doses starts increasing quite rapidly. This is a good thing to allow the folks on the ground to be able to deliver certainly this Pfizer vaccine, which has a high degree of complexity in the delivery.